Hey everyone, Dr. Charlie Johnson, physical therapist, back at it again to talk about an exercise you can do if you have neck stiffness. This video is for you specifically if you have stiffness sort of at the base of the spine, where the neck sort of connects to the upper back, okay? We know that in order to help people have neck pain, we have to make sure that the mid-back moves because the spine is all connected, okay? So if you think about it, if your mid-back is kind of slouched, it's very hard for your head to be upright, okay? And what we end up seeing, the reason why people get some stiffness in their very upper neck, as well as in the base of the spine, is kind of take this little drawing, okay? Here's your nose, okay, so you're facing this way. All right, bear with me. So what you see, right, if this was a hose, right, and there was water flowing through it, you'd see a couple little kink points, right, okay? You'd see that you have a little bit of stiffness up at the top because your neck is kind of hinged backwards, right? But you see that the middle of the spine and then the very base of the spine are all kinds of points where these curvatures happen, right, if we're in a bad posture. So first things first, you have to understand what good posture is in the neck. So ideally, there should just be a little bit of a curve in the neck. You may notice that if you're sitting, doing things, your head pokes out more than perhaps is ideal, and maybe that's when you get your neck pain and or shoulder blade pain or nerve pain down into the arm, okay? So first things first is you need to kind of picture that your head is, or your chin is sitting on a table, and you're just gonna kind of like slide everything back, okay? You don't have to force it, but just sit up tall basically, okay? So bringing that chin a little bit back, not looking up, just sliding it straight back as if it's sliding off the table, okay? And this is a good spinal position. Now the exercise you're gonna do, okay, is pretty simple, okay? So once you understand that good spine position, you're gonna hold, I don't know, this is a pipe, or not a pipe, this is a PVC pipe, it is a pipe. You're gonna take something like this, you're gonna take a broom, a wooden dowel, anything like that, okay? Make sure you clear your surroundings so you don't whack anybody, okay? What you're gonna do is you're just gonna hold it just like this, okay? Fold the arms, whatever you need to do right in front. You're gonna keep the head facing straight forward, good spinal position, so not poking out from the side, okay? Good spinal position, all right? And you're gonna keep the head facing forward while the body rotates. You can't see my feet, but one foot is in front of the other. It just helps stabilize the body, okay? So just gonna help rotate. We're just gonna work on rotation, but notice my head faces forward, okay? So how does this help you if you have stiffness at the base of the neck? Well, think about it, right? If you have a towel, right? In some maybe previous videos for people who have neck pain, you see it, they just recommend kind of turning the head side to side. And while that works, what you're really doing there, if this is the spine, is you're turning it from above, right? Whenever you're doing this, right? Not a bad thing, but to get below and kind of the mid-back and kind of that junctional area where the neck joins the upper back, you're just gonna twist from below, okay? So the head is staying fixed in this exercise. It's straightforward, good spinal position, okay? And you're just one foot's in front of the other. You're keeping the head neutral, just rotating side to side. You'll feel a good stretch in your mid-back, okay? At no point should you be rotating and poking your head out, okay? Keep it good neutral position, okay? So hopefully it helps you if you have back or neck pain that's right at the base of the spine, okay? Kind of right at the upper back area, okay? Try it out. Doesn't matter, maybe do it for a minute, just do it till you feel loosened up. If you're having problems and it just won't go away, email charliejohnsondpt@gmail.com, or if you live close by in the Royersford area, call 484-552-3767. We'll set you up with an appointment. Okay? Thanks.